All right, everybody, Dr. Rafich here from Vet Triage. We are continuing on to this issue of Veterinary Surgery from February 2022. The paper is Outcome of Canine Cementless Collared Stem Total Hip Replacement with Proximal Femoral Periprosthetic Cerclage Application, 184 consecutive cases. And for folks who are interested, I've published several papers on total hip replacement in dogs that you can see here through PubMed. So just search my first and last name, and the papers will come up here. So pretty cool. And let's get going with this. Let's see. All right. This paper comes out of BluePearl in San Antonio, Texas, as well as a specialty hospital in Houston, Texas. And Dr. Liska is one of the authors of this paper, is a pioneer with total hip replacement in dogs in the veterinary space. The objective is to report outcomes of cementless collared stem total hip replacement with proximal femoral periprosthetic cerclage application in dogs. And let's see, retrospective study, 150 dogs with 184 total hip replacements. They placed a single full cerclage wire distal to the femoral neck osteotomy line and proximal to the lesser trochanter. Results found that no proximal femoral fractures occurred, no complications associated with cerclage wire. A fissure, which is one case, or fracture, which is 2 cases, occurred near the tip of the femoral stem. In those cases, postoperatively, they all required plate and screw fixation. All dogs became normal after surgery, and all owners were satisfied with the outcome. Clinical significance: application of a cerclage wire may decrease the risk of proximal femoral fractures after cementless press-fit total hip replacement. So just to give folks some idea here of what we're talking about before we move on, this is a total hip replacement in a dog. The arrow is pointing to a fractured part of the bone, but right in front of the arrow, that metal part is a collar to the femoral stem. And then the down arrow that's black is showing what's called substance, where the femoral stem moved distally down the femoral diaphysis. Obviously, you don't want a fracture, and you don't want substance either. Maybe a little bit of substance is fine, but excessive risks fracture. And also, if the stem rotates, then you also risk fracture as well. Introduction: the incidence of intraoperative calcar cracks in humans was reported as 1.44% from primary total hip arthroplasties. The proximal fissure or calcar fracture in dogs has been reported as a complication that requires revision. Overall incidence of femoral fractures from dogs is 2.9% to 13%. Fissures and fractures can occur during femoral medullary canal reaming and broaching. So in order to put the stem in the femur, you have to ream the medullary cavity and broach it. So you have to prepare the stem you have to prepare the femoral diaphysis for the stem. They may not always be detected. A fissure can propagate during early weight bearing to become a catastrophic fracture if axial forces exceed the structural integrity of the proximal femur. If a fissure is identified early, cerclage wire can prevent widening and propagation of the fissure, decreasing risk of fracture or subsidence. Plate and screw fixation may be used to prevent fissure development to a fracture in conjunction with cerclage wires. The proximal femur is also at risk of a fracture during cementless press-fit femoral stem implantation impaction if hoop strain is greater than the expansile load the bone can tolerate. Post-op, the weight-bearing load during convalescence can increase hoop strain and result in catastrophic fracture. Materials and methods. They place cerclage wire proximal to the lesser trochanter and not proximal to the osteotomy line at the calcar. Radiographs are scheduled for 5 to 6 weeks, and then 12 months after surgery, and then annually. And here's a small radiograph, but you can see cerclage wire. That dog had bilateral total hip arthroplasties, and the cerclage wires placed around the proximal femur. The results found the indication for total hip replacement in 85% of the dogs was arthritis from hip dysplasia. The application of a single cerclage was less than 10 minutes in all cases. Most common dog breed were German Shepherds. There were no comorbidities for these dogs. Other indications for total hip replacement were capital physeal fracture, traumatic hip luxation, subluxation due to traumatic round ligament incomplete tear, basilar femoral neck fracture conversion, osteoarthritis secondary to malunion of an untreated acetabular fracture, and malposition femoral neck secondary to a femoral corrective osteotomy. Cerclage wires were 18, 20, and 22 gauges. The colored stem sizes range from number 6 to number 10. The mean radiographic follow-up was 223 days. So here's other pictures here. Let's see what we can show you. Here is an example of a femur fracture. So you can see there, the white line is showing a line in the femur, the white arrow rather, and then there's a femur fracture there. You see the bone is split like a banana peel. Outcomes and complications: no intra-op or post-op proximal femoral fissures or fractures were noted when they placed the proximal cerclage. Discussion regarding incidence, causes, and prevention of proximal femoral fissures and fractures. Proximal periprosthetic femoral fractures typically involve the calcar area on the medial cortex and lesser trochanter. This complication is compounded by subsequent acute femoral stem subsidence and instability. Rotation into retroversion and prosthesis laxity creates subluxation or luxation and can accompany this complication. The tapering cross-sectional geometry of femoral broaches and the femoral stems from proximal to distal is manually impacted with unmeasured forces into a similarly tapered but smaller femoral medullary canal implant bed preparation. Meaning that when you place the stem in the medulla of the femur, it's going to be a tight fit. And although it requires some pressure to press fit the stem, there's no way of measuring that amount of pressure that the surgeon is placing on the stem. As a result, the fissures can occur in the proximal femur during femoral broaching and during impaction of the femoral stem. Fissures may go unnoticed and, if left unsecured, can propagate into a displaced fracture after surgery. Fissures and intraoperative fractures can also occur during broaching and stem impaction if these procedures are not coaxial with the femoral medullary canal. It is therefore important that the surgeon carefully inspect for fissures during both broaching and stem implantation. Fissures that occur or are present when stem impaction is complete should be appropriately managed, such as with cerclage application prior to surgery closure. We recommend placement of the cerclage proximal to the lesser trochanter and within 1 to 3 millimeters of the medial aspect of the femoral neck osteotomy line at the calcar. This location is where the hoop strain is the greatest, around the circumference of the medullary canal. If the cerclage is distal to the lesser trochanter, the benefits of the cerclage wiring might be lost. Hoop strain and angular forces create a predisposition to fissures and fractures. The peak torsional load to failure of ex vivo femora with adjunctive cerclage wire fixation failed at 20% greater peak torque than femora without adjunctive cerclage fixation. The presence of a cerclage wire increases resistance to stem substance. An in vitro mechanical study looked at the resistance to substance in colorless femoral stems in which double loop cerclage wire were placed after a fissure occurred. The load to initiate substance was found to be increased in femora with a double loop cerclage compared to intact femora. So a mean of 2,379 newtons versus 1,709 newtons. What they're saying here is that if you place cerclage, double loop cerclage in that study, then it requires more forces to create substance, which is where the stem goes even deeper in the medullary canal, deeper than you want. And so it shows that the wire at least protects against that. The mean relative substance for intact femora was 3.99 millimeters versus 1.79 millimeters with cerclage in place. So they're saying that the millimeter distance of substance was less when you place cerclage. After stem implantation, a cerclage provides increased initial stability by preventing expansion of cortical bone and circling the stem due to an undetected fissure or fracture from hoop stress. So when you're placing the stem into the femur, what they're saying is you place a cerclage there, it helps prevent the expansion of the bone and therefore minimizes the risk of fissure or fracture. Initial instability due to a fissure or fracture can then compromise implant position, osseointegration, and long-term implant stability. A double loop cerclage is mechanically stronger than single loop. Double loop application in this location may require that a high enough femoral cut is made or a portion of the lesser trochanter is removed with at least 3 millimeters of bone present to accommodate the wires. Alternatives to cerclage. Alternative options exist to the use of a collar femoral stem in combination with cerclage around the proximal femur. Cement fixation of the femoral stem is prior generation technology that is an alternative to cementless stem fixation, or if an intraoperative or postoperative fracture occurs. Hybrid cementless cup and cemented stem fixation is a viable option. Cement fixation distributes load forces widely over the bone-cement interface to lower the risk of proximal femoral fractures, but diaphysis fractures beyond the cement mantle can still occur. Another available instrumentation implant system called the Kion from Switzerland can be used with good long-term results, has low incidence of proximal femoral fractures, but it depends on screw fixation for stability, and you can still have femoral diaphysis fractures. Another system, interlocking lateral bolt system by Biometrics, aims to decrease fractures incidence resulting from excessive substance. The system requires dedicated lateral bolt instrument set with interlocking bolt inventory, which adds expense and time. The femoral stem used in this system is collarless, which is known to have substance complications. It is reported that 1 to 2 millimeters of settle may also occur with lateral bolt, but as much as 8 millimeters can occur. Collarless stem substance is the underlying reason to use a collared stem, and proximal femoral fracture prevention is the reason to use cerclage. The combination of a collar and cerclage accomplishes both goals and is a favorable cost-benefit scenario. So yeah, great paper. Dr. Liska is always known for having good papers done. And yeah, for those who do total hips, will find this interesting. Otherwise, it's a bit more technical if you've never done one before. And that's that. We'll see you again in the next video. Thanks so much. Bye-bye.